Hello, I'm Ester Silitonga from Faculty of Nursing Pelita Harapan University Tangerang. On representative of the research team, I will present the findings of our research, which is factors affecting the community's attitude toward COVID-19 vaccination. Here's the outline. We will talk about introduction of the study, method, result, discussion, conclusion, and references. On September 18, 2021, the global vaccination rate reached 42.9% or 5.88 billion doses of vaccine. COVID-19 vaccination has only reached 28.02% or around 77.42 million people in Indonesia. And with 44.12 or 15.97% fully vaccinated and 33.29 million or 12.05% partially vaccinated. Knowledge, attitudes, and perception of the community toward COVID-19 are critical for the government and policymakers to resolve all barriers to vaccine delivery. Broad COVID-19 vaccination coverage is critical for COVID-19 control, and it is influenced by the attitudes of those who receive COVID-19 vaccination. Knowledge, education, and financial status all have an impact on attitudes toward receiving COVID-19 vaccination. So the objective of this study is to analyze the factors affecting the community's attitude toward COVID-19 vaccination in the Tangerang Regency. The factors investigated include knowledge, education levels, and income. The population in the study was from Tangerang Regency and ranged in age from 18 to 55 years old. The convenience sampling technique was used and 400 respondents were obtained by measuring the sloping formula. The questionnaire with open and closed questions was used in this study as the instrument. The authors used a questionnaire to assess knowledge of COVID-19 vaccination, education level, and income, as well as an attitude questionnaire. The collected data is analyzed using univariate and bivariate analytical techniques. Univariate analysis is used to describe each independent, which is knowledge, education level, and income, and dependent variable, which is attitude. Meanwhile, bivariate analysis was used to determine the correlation between knowledge, education level, and income with the community attitudes toward COVID-19 vaccination. The G-square test was used for bivariate analysis. The statistical package for the social sciences, or SPSS, version 28 software is used by authors as a test tool for the analysis. The study employs a quantitative method with a cross-sectional approach. The study was conducted at Tangerang Regency and questionnaires were distributed through social media, which is Facebook, WhatsApp, and Line in March 2022. Ethical consideration was obtained from the Research Community Service and Training Committee, Faculty of Nursing, UPH. We can see that Table 1 represents the demographic characteristic of respondents. There were 134 respondents were early adulthood, which is 26 until 35 years, and 206 males, 164 had high education, 260 had low incomes, and 312 had high knowledge. In Table 2 showed that the majority of respondents, 306 have a positive attitudes, and while 64 have a negative attitudes toward COVID-19 vaccination. According to Table 3 of respondents have low knowledge, which is 30, 38, and a positive attitude towards COVID-19 vaccination, while 270 have high knowledge and positive attitude towards COVID-19 vaccination. The G-square test The chi-square test had a p-value indicating a significant correlation between respondents' knowledge and attitudes toward COVID-19 vaccination. According to the findings, if respondents with high knowledge have a 9.284 times greater chance of being positive attitude than respondents with low knowledge. According to Table 4, 34 of respondents have a low education level and a positive attitude toward COVID-19 vaccination. 88 have a moderate education level and a positive attitude towards COVID-19 vaccination. And 184 have a high education level and a positive attitude towards COVID-19 vaccination. The chi-square test produced a p-value indicating that there was a meaningful correlation between respondents' education level and their attitudes toward COVID-19 vaccination. According to the study findings, the majority of respondents had a high level of knowledge and education. Individuals with higher educational backgrounds knew more about COVID-19. It is possible that more educated people are more informed and concerned about their health and well-being as a result of increased access to information sources. More information can lead to well-informed individuals caring about their health and well-being, which can influence participation in life events that affect them, such as COVID-19 vaccination. Furthermore, the study discovered a significant relationship between knowledge and attitude towards COVID-19 vaccination. This demonstrates that a person's attitude toward receiving a COVID-19 vaccination can be influenced by their level of knowledge about COVID-19 vaccination. In other words, if someone has a positive attitude towards COVID-19 vaccination, that person will receive it. In the study, the most of respondents had a higher education level, which had a significant correlation with attitudes toward COVID-19 vaccination. A well-educated person has a more positive attitude and takes preventive measures against COVID-19 transmission, such as getting vaccinated and adhering to health protocols. Increase trust and acceptance of this health protocol as a result of the information obtained, which result in a positive attitude. According to the study findings, the respondents had a low income and there was no significant correlation between their attitudes toward COVID-19 vaccination. This shows that not all respondents with a positive attitude toward COVID-19 vaccination have a high income. In other words, respondents with low incomes can have a positive attitude towards COVID-19 vaccination. A previous study found that income cannot be used to predict respondents' attitude towards COVID-19 vaccination. Vaccination recipients in low to middle income countries have the perception and belief that vaccination is effective and safe in preventing disease spread. This is influenced by the dissemination of information about the benefits of vaccination, which increase their knowledge and insight and encourages a positive attitude. This positive attitude and a higher level of acceptance of the COVID-19 vaccine are influenced by a desire to learn more about the COVID-19 vaccine's benefit rather than economic conditions. The study found that most Tangerang Regency respondents had a high level of education, low income, and high level of knowledge and positive attitude. Furthermore, the study discovered a significant correlation between respondents' knowledge and attitudes toward COVID-19 vaccination, with high knowledge having a 9.284 times greater chance of having a positive attitudes than low knowledge. However, the study discovered a significant correlation between respondents' education level and their attitudes toward COVID-19 vaccination, but no correlation between respondents' income and their attitudes toward COVID-19 vaccination. According to the findings, public health officials should put strong COVID-19 vaccine education campaigns utilizing traditional and social media, with a special focus on involving social influencers and target audiences. The most effective way to reach communities with COVID-19 information was through mass media and public health campaigns and outreach activities. This is references that we use through our research. Thank you. That's all from our presentation. Thank you very much for your attention.